Hi everyone, I'm Danielle Ruiz. I'm the CEO, founder, medical director, and medical provider at Everest Health. And our goal there is really to help you reach your pinnacle, to be young, to be optimized without decline. Today we'll be talking about just in the barest of bones, what we can do for our patients and what we can do for you. Of course, in the future, the next 10 years or so, there's going to be really exciting changes in the field and everything's going to change, but it's still important to talk about what we can do today. So a little bit of background at Everest. It's an international medical clinic based out of the US, right outside of Washington, DC. And we provide personalized medicine for this new age of longevity and health span treatments to give patients every option that's currently available. Of course, it generally takes about 14 to 17 years for new research, new science to reach the mainstream, to become part of guidelines for everyday medicine. And unfortunately, in 17 years, a lot of people suffer and a lot of people die. So we don't accept that. We want to bring things as soon as they're safe and proven. This Methuselah protocol is what we use. It's a body of interventions that are safe, that are evidence-based, science-backed, and it's really the best in class, whatever we have currently available to help patients live longer and better. We work together with patients, their current health, their health risks, their lab data, their preferences as well, to tailor the Methuselah protocol individually to everyone. We all, as humans, we want to feel good, but it's very challenging to reach our optimum health and to maintain it. It takes a lot of effort. Sometimes it takes some humility to ask for help as well, and it takes a lot of long-term motivation. So we're there to help you, to make it as easy and as pleasant as possible to be your Sherpa, if it were. Our goals generally, both for me as a provider and for patients, is to live as long as possible, but to live healthy. No one wants to live 300 years, but still to be aged and ill and suffering and dependent on others by the time you're 80, as is usual today. We don't want life in the absence of health. A couple days ago when we first came to Dublin, we were sitting next to someone, a couple of gentlewomen, and they were talking about their parents. And one of them, their parent is in his 80s. He has a lot of chronic diseases, and everyone in the family is talking about whether they should begin end-of-life care or continue to have him undergo surgeries and, really not enjoying life. And that's just not acceptable. Having worked in end-of-life care, worked in nursing homes, the current situation for aging is just not acceptable. No one should have to suffer the way that humans do today. And that really has been a big motivator for me to bring the Methuselah protocol to everyone, not just billionaires, but to the average person, to make it possible to live healthier and enjoy life more. Treatment is important. Most people come to me already diseased in some way, shape, or form. That makes sense because our current paradigm in the healthcare system is not designed for health. It's designed to just not die today. Additionally, it's really hard to stay motivated, to stay healthy. So a lot of people don't take it seriously until they have a big health scare. And of course, you're going to need treatments for things like auto accidents and genetic conditions that aren't preventable. Prevention is a big part of what we do. We want to catch a disease early. That's secondary prevention, and that's usually where the medical system limits themselves. But that's not true prevention. Prevention is being a healthy state, not just finding something early. Optimization is ideal. It makes me happy. It makes patients happy to be in a state of actual health, and we want to reach that pinnacle of health. And that's important not just because it feels good to be optimized, but it's also important because anytime our systems aren't operating perfectly, optimally, the other systems have to pick up slack, and we don't feel as good. We have more strain on our body systems. We have more risk, and we begin aging much quicker. For example, I'll wager that just about everybody here has had a back strain or injury at some point, and you probably can relate to the fact that you're likely to get injured again you're walking funny, you're making different choices in life. Maybe it's isolating you, preventing you from doing things that you really enjoy. That increases your stress hormones, you're not sleeping well. So really, nothing is little. Everything affects our whole body and can affect our life as well. Optimization lowers our risk, it helps us live longer, live healthier, and it also gives us additional benefits. It gives us the hope and the bandwidth to pursue things that maybe we didn't consider possible since we were 50 or 30 or even ever. It gives us the ability to continue progressing. And really, life, being truly alive, is about momentum. My great-grandmother, who lived well into her 90s, used to say, "As long as I keep moving, they can't bury me." And that's very true in every aspect of our life. As long as we continue to progress, we continue to learn new things and bring on new skills, that's really life. It's not just surviving. We want to thrive. So how are we going to actually accomplish that? It's a nice idea. The Methuselah protocol is multifaceted. We do use traditional mainstream medicine. We use medications that are FDA approved off-label according to the most recent and up-to-date research, very well proven. We use non-medication interventions, things like cognitive behavioral therapy to help people hack the psychological components of aging, to stay motivated, to really tap into why they want to be alive in the first place so they can make those choices easier. Things like neurofeedback, hyperbaric oxygen therapy, platelet-rich plasma, a whole multitude of exciting things. We use natural options that are non-pharmacological, like vitamins, herbs, and supplements. Highly personalized lifestyle changes, obviously diet and exercise, but things that are tailored to a person's risks, person's goals, as well as like air quality and water quality, things like that. We also use very advanced metrics. That's a thing that has been talked about a lot today already. It's a problem in our traditional medical system, not having those reference ranges that are updated. A lot of them are very old. They're to a very specific population. Sometimes those metrics are populations that include ill individuals, so we really don't want to look like average. And that's why many times patients come and they already have chronic kidney disease, and they've never been told, it's never been followed up on, it's never been treated, because they're considered to be fine. They're considered to be healthy enough. So we have developed updated reference ranges that are specific to age and that are specific to all-cause mortality risk, so that we can really identify where patients are in terms of health and what's going on, what we can do to fix what's not optimal. At the base of things with the Methuselah protocol is research. Really, anything is on the table that's new and coming out. We want to stay up to date with whatever the best option is today and tomorrow and in the future. As long as it's safe and it's proven, it's actually evidence-based, and it's also aligned with patient goals. So if a patient brings a treatment to me and wants to try that treatment, I'll be researching it, making sure that it's appropriate. Alternatively, a patient says, I really don't want to take any pills, period. Okay, we'll figure out a way to make that work for them. This research is from the Methuselah Foundation. I am and have been a fellow of geriatric medical research at the foundation for the last 7 years. And together with the foundation and their team of other amazing scientists, we've put together the most seminal, newest, most cutting edge research for interventions, tests, way to determine a person's biological age, and really what optimal health is for them. And of course, that's not done. We continue to update things to make sure that everyone has the best options every day. So we're going to kind of switch gears a little bit, and we'd like to pretend that you're a patient at Everest Health. We go through a series of questions, of course, an in-depth history and everything too, but to try to determine the best way of approaching the protocol, tailoring it to you. So welcome, it's very nice to meet you, and let's find out who you are and how we can tailor the protocol to you. First off, what is your comfort level with longevity medicine? That seems like kind of a throwaway question, but really, as longevity medicine becomes more mainstream, lots of people, soccer moms, are wanting longevity medicine, even if they don't understand the science, they don't know the options. So it's on me to help educate people, because really everybody wants to live longer and healthier, so we have to bring it to the masses. That's really exciting for me. I really enjoy educating people, and also seeing the world change. We need to change the world one person at a time. On the other side of things, I have patients who are very, very familiar with longevity medicine, who probably have been self-experimenting for many years or decades even. And I also really enjoy that, because it's nice for me to be able to bring value to people who are experts in the field. And often I get to learn things too. And of course, just talking with people who are like-minded is fun for me. Next question is, what is your preference for interventions? Regardless of your familiarity with longevity medicine, most people have kind of a philosophical outlook as far as how they approach their health and medicine. If you're someone who prefers lifestyle changes and kind of believes that the body does its own thing, you just need to help it along. If you're a more natural person, you prefer natural options. Or if you have a lot of confidence in traditional medicine, if maybe you're a little skeptical of old things that are now being researched or new interventions. And I also have a lot of patients who really just want the cutting edge, even if it's not 100% proven or still being researched. They want whatever is the latest and greatest. So really, we can make it all work. Again, as long as it's safe and proven, we're happy. But we usually land on some kind of combination of all three, something that will work specific to the patient. Next question is, how do you approach change? And this is a really big one, not just for determining the protocol to begin with, but also to hack into how to maintain the protocol for the long term, because the goal is for you to live a very long time, and motivation becomes a lot harder to maintain the longer that you're doing it. Are you an all or nothing person? Do you jump into things 100%? Or do you prefer kind of taking things baby steps, adjusting and planning and doing things little by little? So if you're a baby steps person, for example, we can maybe alter things because you'd likely become very, very overwhelmed if we start the whole thing all at once. If we start medications and supplements and a whole bunch of lab testing and a completely overhauled diet, it's going to be too much potentially for a person. Versus if you're an all or nothing person, we probably need to prioritize speed and the magnitude of results so that by the time whatever your big motivator was has worn off, you have the motivation of outcomes. Also, if talking about long-term motivation, if you're a baby steps person, then it's a little bit easier because we can probably just do a little push or back off of interventions a little bit to regain that momentum. Whereas if you're an all or nothing person, we need to really manage burnout because there's a greater risk that you'll throw in the towel completely or try a different regimen that may not be as effective. And then the last question as far as this goes is, where are we starting? Do you show up to your appointment still wet from a triathlon, or are you really rapidly approaching the cliff of health, that point of no return? People who are young and healthy stand to benefit the most from a longevity protocol because they're going to be having more health to begin with, less strain on the body. You're going to be exposed to positive things for a longer period of time and negative things for a shorter period of time. But again, you need to maintain these changes for a very, very long life. People who are closer to the cliff, they have a lot of chronic diseases, they're already aged. Still, there's always benefit, there's always improvement that can be made, but sometimes we have to adjust our expectations a little bit. Like they were mentioning, going back to an age of 20 from an age of 90 is not likely at this point, but we can get a lot of benefit and a lot of improvement just from a small amount of change in terms of our biological age. And really, it makes me happy on both fronts. For people who are younger, it's nice to know that I can have a big impact on someone's life. And also, many times people who are younger have more expectations, higher, loftier goals, and that's exciting for me. And for someone who is already aged, being a geriatrician by trade, it's very, very heartwarming to me to know the difference that I can make in someone's life and also in the life of their family. So let's have a little exercise and meet a patient. Meet Bill. He's a cutie. You're going to love him. He is someone, as an example, who is very familiar with longevity medicine. He has been self-experimenting for years. He is an all-or-nothing person, and he has a lot of chronic diseases. His most recent experience, his driver for coming to the clinic, is he's had a few mini strokes lately, thankfully with no long-term effects, but he's really motivated to change his health and overhaul it. He's older than his age. His biological age is higher than his chronological age, and based on risk factors, he probably will be on insulin within the next 2 years and have had a major cardiovascular event that'll limit his independence within the next 5 years. So let's just look at an example of a protocol that we would do for Bill. Bill currently is only on metformin. It's a great medication choice, but in his instance, I prefer semaglutide because there's really, really good outcomes for cardiovascular risk as well as all-cause mortality. And he needs a bigger overhaul because of his significant body composition issues, his significant metabolic syndrome. We need something stronger to reverse his diabetes, to get away from an ill state and actually to a healthy state. We're also going to switch his beta blocker to an ACE inhibitor, which is safer long-term, it's far more effective, it has less side effects, and it's also kidney protective, which Bill will benefit from. We'll start tadalafil, which is not just for erectile dysfunction, most people know it as that, but it has some benefits for blood pressure, it's cardioprotective, and it's also really good for his prostate. We're going to focus on high-dose antioxidants that have senolytic effects and will work well with the sirolimus, with the rapamycin. We're going to focus on herbs and vitamins and supplements that will have the most crossover benefits and the greatest impact for his life and all of his diseases. For example, bacopa is an excellent choice for Bill. It's an antioxidant that's able to pass the blood-brain barrier, which is a bit unique. It's a nootropic, it's an adaptogen, and the combination of fisetin and melatonin have additional benefits. They help to boost each other and have more brain and antioxidant benefits. Lifestyle changes. I don't want to go into too much detail and bore you, but we would focus on obviously things like diet and exercise, and then also individual foods that are targeted to his diseases like walnuts and fennel, things like that. He would benefit from hyperbaric oxygen for his brain and cardiovascular health, healing rate, immune system, and for him and many patients, cognitive behavioral therapy is great for motivation, happiness, social isolation. Betty is our next patient. She's someone who's not really familiar with longevity medicine, and she prefers natural, non-pharmacological options. She likes baby steps, she's a planner, and she's really in the last couple of years had a huge change to her health. She felt like she was pretty healthy all of her life. She had a good lifestyle, but she started collecting these chronic diseases, these immune diseases, and they're really affecting not just her quality of life and her risks, but also making it really hard for her to make good lifestyle decisions for the long term. So what are we going to do for her? Because she has autoimmune disease, we really need to target her immune system health as well as her inflammaging. And her biggest symptoms that are affecting her ability to have a healthy lifestyle are pain and fatigue. So those are our number 1 and number 2. Rapamycin is a great option for her. Reducing that senescent cell burden, inhibiting mTOR is going to help her immune health, improve nutrient sensing and metabolic function at the very least. It has many other benefits. For her, metformin is a great option for overall health span, but also for her reproductive hormones, and it works well with the rapamycin for mTOR inhibition. We're going to get rid of a couple of medications. They at least are in part causing her kidney disease, her reflux, her bone density issues, and we really don't want to be taking any medications that are causing harm and not having any benefit. So it's like putting on a Band-Aid, it's not going to help healing, and it's probably going to take hair and skin with it. It's not a good idea. We prioritize natural options per her preference, And again, we're trying a crossover so that taking a few options will make a big difference. So for example, N-acetylcysteine will boost her glutathione, and that'll have benefits for her immune health as well as liver enzymes. Pycnogenol is great for her varicose veins as well as her muscle pain. CoQ10 will be great for chronic fatigue and polycystic ovarian syndrome. We start lifestyle changes as well, focusing on things like seaweed and mushrooms for thyroid and immune health, at the very least, much more in depth than that. And she prefers neurofeedback for her insomnia and anxiety. And then last patient is Brian. Brian is a young guy. He's a professional. He works long hours, but he's very devoted to his athletic pursuits as well. He's trying to get to the next level of performance in every aspect of his life. He's not satisfied with just being okay. He wants to be truly optimal and healthy. His perceived health is really great. He has a great lifestyle, but it's not really focused on his family history risk and his current health. So for example, he's a very healthy guy overall, but the same things that are making him healthy by being a highly motivated person, being very active, are also putting more strain on his body, having more stress, more physical injuries that are early as well we need to focus on. So Brian likes the cutting edge. He's up for a very significant stack of things. He prefers natural options, so we're not going to do any pharmacological prescription medications for him per his preference. And he wants everything to function optimally. So we choose multi-system antioxidants, supplements for cognitive performance, cardiovascular health, athletic performance, all-cause mortality with an additional focus in his family history risks. He's going to cut back on alcohol, which will help his liver enzymes. He changes up his diet, cuts out sugar and processed foods and things that are kind of obvious. And he also starts intermittent fasting and a 72-hour fast once a season. He's refocused his exercise regimen to one that is more focused on performance and function long-term. He's got rest days and changing the type of exercise that he's doing. We're also going to do autologous platelet-rich plasma for him to address his current injuries, his knees, his back, as well as his scalp for hair density. As far as outcomes go, we've touched on that a little bit. We are looking to extend the healthy lifespan, but it's a bit early to claim that because we haven't been doing things for 80 years yet. Really, the goal is to be able to help people to live longer, be biologically younger, to have a slow or halted progression of disease and the aging process. And we really can expect remission or even cure of illness depending on what a person has. Certainly improvement or optimization in each body system. And of course, if we're optimized, then we're more resilient to issues. For example, having a patient that in the course of 6 months went from a grip strength of 24 kilograms to 44 kilograms, which is the equivalent of about 30 years younger. Another patient had a gait speed that indicated he was the equivalent of like a frail 90-year-old, and he was able to go down to a healthy 50-year-old in the course of a year. Of course, getting rid of things like metabolic syndrome, getting insulin sensitivity to be optimal, and reducing family history risk is our priority too. So we've come to the end of the presentation. Thank you all so much for your patience.